You sit down at the end of the day, take off your shoes, and your ankles and feet look nothing like they did this morning. Puffy, heavy, sometimes tight enough that your shoes barely came off. You press a finger into the skin, and the indentation stays there for several seconds before slowly filling back in. You have tried putting your feet up. You have tried drinking more water. You have tried compression socks. And while some of these things help temporarily, by the next evening, the swelling is back. When you mention it to people, the response is almost always the same. That is just gravity. That is just your circulation slowing down. That is just what happens as you get older. I want to tell you something that 15 years of vascular clinical practice has made absolutely clear to me. That answer is incomplete. Leg swelling that returns every single day has specific identifiable causes, and in the majority of cases, those causes are addressable. By the end of this video, you will know exactly what is driving the swelling and a practical step-by-step plan you can begin implementing tonight. Before we go further, drop a comment below right now and tell me honestly, how long have you been dealing with this? And if someone has told you to simply accept it as part of aging, add the word dismissed to your comment. Let us begin. Before we go through the causes, I need you to understand one thing that changes how you think about this entirely. Your legs are working against gravity every single hour you are upright. Your heart pumps blood downward into your legs easily because gravity helps. But getting that blood and the fluid surrounding your tissues back up to the heart, that requires active effort from your body. 3 systems do this work simultaneously. Your veins, which carry blood back upward using a series of one-way valves that prevent backflow. Your veins, which carry blood back upward using a series of one-way valves that prevent backflow. And your lymphatic system, a network of vessels that drains excess fluid from your tissues and returns it to circulation. When any one of these 3 systems slows down or stops working efficiently, fluid begins to pool in the lowest point of your body. Your ankles, your feet, your lower legs. Every hour of sitting or standing still without moving your calf muscles, fluid accumulates in your lower legs at a rate your lymphatic system cannot keep pace with. Movement is not optional for your circulation. It is the mechanism. I want to tell you about a patient, a 72-year-old woman, retired, active, who came to see me after 7 months of legs that were noticeably swollen by mid-afternoon every day. She had tried compression stockings, she had elevated her legs every evening, she had reduced her salt intake. The swelling always came back. She had tried compression stockings, she had elevated her legs every evening, she had reduced her salt intake. The swelling always came back. She had been told by 2 different people that this was simply what happens as you get older. When we sat down together, we went through her full picture. She came back 6 weeks later. The swelling had reduced by more than half. She told me, "I thought this was just my life now. I did not realize there was something I could actually do about it." Cause number 1. And the most common cause I see in clinical practice is something called chronic venous insufficiency. Your leg veins contain a series of tiny one-way valves. When these valves weaken or become damaged, they no longer close completely. Blood that should be traveling upward falls back down, pooling in the vein below the faulty valve. This pooled blood increases the pressure inside the vein. And when venous pressure rises above a certain threshold, fluid begins leaking outward into the surrounding tissue. That leaked fluid is what you see as swelling. It is not water you drank. It is not salt you ate. It is fluid forced out of your veins by pressure they can no longer contain. It often gets attributed to aging or inactivity, rather than to a specific vascular mechanism. Warning signs include a feeling of heaviness by afternoon, skin around the ankle that appears slightly discolored, and varicose veins visible on the surface. The most effective approach begins with consistent calf muscle activation. Your calf muscles are the mechanical pump that pushes venous blood upward. Every time your calf contracts, it squeezes the veins and drives blood toward the heart. Pro tip: when you do elevate your legs, elevate them above the level of your heart. The ankle needs to be higher than the hip for gravity to assist venous return effectively. 15 to 20 minutes twice daily makes a difference. Cause number 2, lymphatic system insufficiency, is one of the most consistently overlooked causes of daily leg swelling. Your lymphatic system is a parallel network of vessels running alongside your blood vessels. Unlike your blood vessels, your lymphatic system has no pump, no heart driving it forward. It moves entirely through muscle contractions, breathing, and body movement. When you are sedentary, flow slows dramatically. The most effective approach for lymphatic insufficiency is deliberate daily walking. At least 20 to 30 minutes of continuous walking, where the rhythmic contraction of your muscles drives lymphatic fluid upward through the vessels. Pro tip: if walking is limited by joint pain or mobility, ankle circles performed while seated are a highly effective alternative. Rotating each ankle 20 times in each direction stimulates lymphatic drainage without any weight bearing. Cause number 3, and the one that surprises almost every patient, is medication-induced leg swelling. Over 70 commonly prescribed medications list leg and ankle swelling as a recognized side effect. Over 70. The drug class most frequently responsible is calcium channel blockers, commonly used to manage high blood pressure. These medications work by relaxing blood vessel walls, but they can cause vessels in the legs to dilate and leak fluid. If your leg swelling began around the time you started a new medication, this connection is worth raising with your doctor. Please never stop or adjust any prescribed medication on your own. Always have this conversation with your doctor first. Cause number 4. The combination of dietary sodium and reduced kidney filtration efficiency is one that most people partially understand, but very few understand at the level that actually changes their behavior. When sodium levels in your blood rise, the body retains water to dilute it. That retained water increases the total fluid volume in your circulatory system, and the excess finds its way to the lowest point of your body, your legs. Hidden sodium is the specific problem most people never address. The majority of dietary sodium for most adults does not come from the salt shaker. It comes from processed and packaged foods and restaurant meals. Pro tip: increase your potassium intake. Potassium directly counteracts sodium's effect. Bananas, sweet potatoes, spinach, and avocados are among the highest sources. Adding these to your diet creates a significant combined effect. Seek medical attention promptly if the swelling is in one leg only, particularly if accompanied by warmth, redness, or pain. This can indicate a blood clot, which requires urgent evaluation. If you have shortness of breath, seek help immediately. Here is your complete action plan starting today. Tonight, elevate both legs above heart level for 20 minutes before bed. Ankle above hip, not just on a footstool. Tomorrow morning, begin your day with a 20 to 30-minute walk. This week, set a reminder every 60 minutes during any period of sitting, and perform 20 calf raises before sitting back down. Aim for under 1,500 milligrams of sodium total daily. Make an appointment with your doctor to review your full medication list and ask specifically about fluid retention. If you have not walked regularly, start with 10 minutes daily and add 5 minutes each week until you reach 30. The calf muscle pump is the most powerful tool your body has for returning fluid from your legs back to your heart. Every step activates it. That swelling is not something you have to accept. It has a cause, and now you have the information to address it. In my next video, I'm going to talk about 5 specific nutrients that directly support vascular and lymphatic function. You are not going to want to miss that. Please subscribe and hit the notification bell. Share this with someone you care about. Drop a comment below. Tell me which of the 4 causes you think applies most to you. I read every comment personally. Because remember, this is not about age. It is about information. And starting right now, you have it. Take care of yourself.